Welcome to the Eyelid Center of Utah, where we specialize in the art of eyelid surgery. When I moved back to Utah, I wanted to create a practice where the patient is the center of what we do and where we can deliver compassionate care tailored to the individual differences and changes in each person's face. One of the really interesting misconceptions about facial aging is that we tend to think that things just kind of drop. And in certain areas, they do sag a little bit. But the other thing that happens is that there's deflation of the tissues, and that's because of loss of fat in some of the fat compartments of the face. Understanding the different dynamics of sagging versus deflation kind of helps to determine whether increasing volume in some of those areas and increasing the projection will help restore that youthful appearance. So a common thing that I hear is I feel a lot more youthful than I see when I look in the mirror. And a lot of that has to do with loss of volume in the face. That's one of the reasons why fillers have become so popular in our culture, is that people want to kind of add that volume back into the areas that have lost it. And that does make sense. Around the eyes, sometimes fillers can give a little bit of an overdone appearance. That's one of the reasons why my preference is to use something called fat grafting. So that's using the body's own tissues, fat from other parts of the body, filtered into almost like a liquid consistency to help restore some of the volume in those areas, give more inflation to the areas that have lost it and more projection, and not use fillers as much in those areas. Fat grafting can be used in many different areas. The most common areas are the lower eyelids, the cheeks, the outer eyebrows, the temples, even areas like around the lips or the back of the hands. It's very useful because you can see the results immediately when you add that volume back in to the areas of the face or the body that have lost it.